So what we need from that, we use a glass size. I'm going to bring in my tubes that I need. I'm going to bring in an empty syringe, 10 cc, and a 10 cc syringe with saline in it. I'm going to bring in an 18 gauge needle, and I'm going to bring in some alcohol pads. So as you can see, there's 3 lumens on this one, and they're all labeled. Proximal, this is proximal, this is distal, and this is medial. So when I draw blood, I want to draw it from the proximal line. Does everybody know what proximal is? It's the one closest to the patient. Distal is the one furthest away. Okay. And so what I'm going to do is a clean procedure. I'm going to look at my order, doctor's order. I'm going to look at, see what kind of labs they want us to draw. I'm also going to bring in a couple stickers from the patient's chart that has their name and their account number and all that. However many tubes I have, that's how many labels I'm bringing in. And a biohazard bag, which I don't see here, but clearly it's like a baggie, but it has, it's red, says biohazard. Okay, so I'm going to come in and I'm going to say, Mr. Brown, my name is Marcia, I'm a vet student, and I'm going, the doctor has ordered some blood to be drawn, so that's what I'm in here to do. So first of all, I look up and make sure it's in the computer, and I have my I'm going to take my saline now. And just, I always shoot a little bit into the bag because it comes out really hard to begin with, and you don't want to make your patient jump because it can hurt. So I'm going to take my proximal in. All the ends are clamped still. I'm going to alcohol wipe it. I'm going to attach my syringe. Get a little air bubble out of it. Unclamp it. And I'm going to push in my 10 cc. Oh no, this is more like the 7 or something. Push in my saline. Then I'm going to withdraw 10 milliliters of blood. Why do you think I'm going to do that?
You have to waste it.
We have to waste. And waste because, you know, there is heparin in there, there's saline in there. I want to get the freshest blood I can.
To make sure it comes in the
So that's why
but then they took out
my clamp.
the empty syringe.
It's always important to clamp. Why is it important to clamp?
Air.
Air, or even like if this happened to come off, they could bleed out. I always want to. This I discard in my sharps container, or I just get it out of my way because I don't want to mix it up. Okay, so now I'm going to clean my side again. I'm going to hook up my empty syringe, and then I'm going to withdraw as much blood as I need. Now, how do I know how much blood I need? Each of these tubes have milliliters written on them. Like this one's 3.5, this one is 2, so I need 5.5 milliliters. I'm gonna pull out this to be safe. And I'm going to clamp again. I clamp after each intervention. Then I'm going to take my 18 gauge needle, open it up, put it on here, so that I know that this is the fresh blood that I'm going to put into my bottle, and I won't get mixed up in any way. Then I'm going to take my saline.
But I don't know if I can. But you did great because like you had one hand on the cap.
Now technically, if you just open that needle, the needle should be sterile, right?
Yes.
So it should be able to just go right back onto the flesh.
She had it in her pinky. I didn't do that. You know what I mean? She's like, oh, you said what? So now, when you're pulling it out.
So you just flushing it?
Now I'm flushing saline, because I'm done with my procedure.
So this is flush. Yeah. Now when you release the band.
Clamp again. Take my heparin.
So if you should I still?
You have to clean before every, like,
Pardon me?
you have to clean before, like, every,
I don't want to squirt anybody. There we go.
So you do have to clean the hub before every.
Uh-huh.
Because it's been like exposed to the air.
Oh, right. I mean, I knew.
It's just gonna be like learning how to, I don't know.
I unclamp and push my 5 cc's of heparin in.
And now you know.
Clamp it.
Yeah, you already did that.
Heparin, 5 cc's.
In that little thing. And then I'm done as far as patient end is concerned. So now I'm going to just push the needle in. Oh, and it's no longer a vacuum, so otherwise it would suck it in. So I'll just push in a couple. You're not supposed to really push it in, it's let it take its own fluid, and then you're going to rock it a little bit, mix in case there's any additive in there, and then do your other needle or other vial.
Do you have to clean those?
They should, they're depressed in there, so they should. You might have a little blood on the outside though. So. And then I'm gonna plant my needle, I'm done with that. We'll discard these in the sharps, all of our syringes we're gonna discard in the sharps. And then I'm going to take my labels, put my label on the side of my tubing. I'm going to put my date, my time, my initials, and then I'm going to put what test this is, like a CBC or platelets or anything like that. Then I'm going to take these two and put it inside the biohazard bag, and then I'm going to send them to the lab. And then I'm just going to clean up. I do want to show you this though, because this is really neat. A lot of hospitals use these instead of the needle, because this will hook right on here. Okay. I guess this is where you would take the tip off. And it hooks. Ah, it doesn't hook under that either. Well,